Life Adventure News.
Right now, there are 5 vaccines that kids in California have to get to go to school, and a lot of people are wondering if the eventual COVID-19 vaccine will be added to that list. Our ABC 10 News is going in depth, and our Derek Stahl found history offers several clues.
Imagine a deadly virus causing quarantines, social distancing, and a run on breathing machines. That's what prompted California's first mandated vaccination for school kids in 1961. The virus was polio.
We're seeing a repeat of history in so many ways.
Dr. Rahul Gupta is with March of Dimes, the nonprofit that funded the polio vaccine effort when the U.S. government would not.
At the time, this was the largest volunteer effort in American history.
With their funding, Dr. Jonas Salk launched a massive clinical trial on 1.8 million kids in 1954. The vaccine was declared safe and effective almost exactly a year later, and within days, 5 million kids got the first dose. But it didn't become mandatory in California for 6 more years in 1961. Fast forward to today. On its website, the California Department of Public Health seems to suggest that a COVID vaccine could become mandatory at any point, saying COVID-19 update. Immunization requirements remain in place for now. Any updates will be posted here. But Dr. Gupta thinks that's unlikely when the vaccine first comes out.
The supply will require us to make sure that we prioritize the highest risk population, including healthcare workers.
He points out the polio vaccine had huge clinical trials on kids, and currently the coronavirus vaccine is only being tested on adults. And he says kids and adults have different immune responses.
It's going to be important to know because children could mount a response that may be adequate, or it may be troublesome in some ways.
Now, from a technical standpoint, state officials could add a vaccine to the mandatory list in 2 ways, by passing a bill or through a regulation issued by the California Department of Public Health. CDPH says this process can typically take years, but in an emergency, it could be done quickly. The last vaccine to be added to the mandatory list was for chickenpox in 2000. That was 5 years after that vaccine became available. Derek Stahl, ABC 10 News.
And we asked the Department of Health yesterday about the circumstances that would need to be in place to put a COVID vaccine on the mandatory list. We're still waiting to hear back.